We want you. I mean, there's good things about setting it up, but the other big part is learning how to troubleshoot. What am I missing?
You're like,
Because you might, you know, Michael might not be there, Erica might not be there. It might just be Owen setting this up or doing the SST. You know. Leanna, come over here so you can help him. Stay on the side. Oh, and if you can't figure out, Leanna's right there.
All right.
what goes on there? You should.
Just go down on there. There we go.
So, but we don't have to take for every facility.
No, actually, if, once we got a chest X-ray on this guy, and we saw the
Tubing down.
Okay.
What's that? The inspiratory filter?
get him up to the ICU,
This one?
I mean, what is that?
Inspiratory filter.
Yeah.
And guys, when you're setting it up, okay, talk it out amongst yourself or yourself.
See what it is.
Inspiratory
We're actually
filter.
doing Inspiratory
Expiratory filter. Or we
Tubing.
did, yeah, inspiratory.
So inspiratory
Circuit?
filter,
Inspiratory circuit
inspiratory circuit.
goes to
Okay,
the.
and try to make it neat. So see how Owens is kind of like all over the place. This is what you want to do. The moment you get the circle out, okay, straighten everything out. I like to myself to swing this. It's clean, right?
Because if you drop it, what are you doing? You start over.
See that? You got 2 free hands all set up. Then you just pick this up, straighten it up.
Cool.
Okay.
and a lot of times, a lot of portable X-rays.
Because if you're doing this and fudging around, there's a good chance that
Drop down.
you drop it on the floor, and guess what? Jay will take the head off. And if you're in the facility and then you have to change the whole circuit, that means you're wasting all your department has a quota of how much money you make every year.
You're gonna do that on your own, you're gonna
So
write them all down.
the more circuit you waste, the less equipment you're gonna get in the next year quota, or you're gonna get no raise.
It was insane.
Yeah, so you guys, I would start.
I'm gonna do that tonight.
You know, besides your RSI is going to have some medication in it, so you can apply that to what you're going to see on your ICU prep, right? Because the RSI is going to be very important. I mean, besides the cardiac meds that you're going to see in the ICU prep, you're going to have all your paralytics, your sedations,
Because you gotta block it.
your anti-anxieties. They always come in hand in hand. Because the paralytic is only there. Paralytics only last about 2 to 5 minutes. All depends on what you're using. So that means you need to have sedation and some kind of.
And you test FST. You have to hit the test button in like 5 seconds, and it's over there. So find the test button first.
Yeah.
No, on the sound.
Burning, yeah.
Screaming, like I woke up screaming on the operating table.
Yeah.
And so
Okay.
after you hit
Yeah, I didn't know.
FST, you gotta hit that so quick, so it's like find where it is
It
first.
just gives you. It only gives you a
They
second.
were like freaking
So you hit SST and then hit test right away.
Well,
Yeah.
No.
They'll tell
What's going
you.
on? It won't let you do it because of that.
Procedure error. Patient connected before setup complete.
Oh, you take this one.
Reconnect circuit. Oh, I know.
What's first?
It's not plugged in.
Plugging it in.
It's all set up except for something. It has to run to an SSD.
What's mine?
It's not plugged in.
Let him do it. Let him do it. Let him try it. You're not helping him by helping him.
I know.
The other part, you don't need the HME at this moment. The other part is the moment, you're gonna see this, right? Go ahead and turn it on.
Procedure error.
Okay, now unplug it. No, yeah. Take the whole elbow, not turn it on.
Do an SST, there are 2 buttons. Right? You're gonna hit the button on the screen.
Pretty good, huh? So it's because it's occluding the pressure,
You know
Yeah.
your stuff.
right? So the moment you have the circuit on, that elbow is going to be on it automatically. So keep it in your head the moment before you turn it on. Take
Have
that out,
open.
right? Because there's nothing worse than Jane and I, or Bruce and Jane, are going to be sitting like this, right? And when that alarm goes on, what do you think is going to happen to yourself?
You're
You're gonna
panic.
You're
panic.
going to
You're not gonna
panic.
know what
What do you
You
think
know
is
you
going to
get
happen next?
timed.
You're gonna forget.
You forget everything. You're going to start sweating.
So the
Okay.
elbow, you're saying the little this thing. You want to
Yep.
take off
Take
before
it
you
off
press
before
start.
you turn it on.
Okay.
Okay? Anytime you turn on an event, you take off that elbow or whatever's included.
They have,
Okay, Leanna, you can go ahead.
But they had, remember they had the, you actually had to like replace the sterile water.
Let's see if you figure it out.
Disposable one.
yes.
What does it say? So did you notice it?
that's
Okay,
just
so leave it like that for a second.
No, but like.
Okay.
First, just put it
Go. See how it only gives you about 30 seconds? Okay. Look over here, guys. Ashley, Michael, come on over here.
I only knew vision, so.
See the test? Okay. So press on that SST again, and press on that immediately, and it brings you to this testing screen. Are we doing adults?
Sure.
Okay. Let's say we're gonna do pediatrics,
So right now, it's
neonatal.
failing. Why do you think it's failing?
Okay. Do we want to use humidifier? No, because we're in HME, right? Okay.
So,
Do we agree? What does that say?
that's way back when I restart the SST.
So adult.
Yep. Just leave it like that. It's black. Okay. Okay. Let's follow direction.
Except, and it's gonna
Oh,
have
without.
block the line. So you have to put, that's the line. So when you block the line, you hit accept, right? You feel like that's easy?
Now, are we gonna have to do the humidifier and stuff during our tests, or? Will they
With
have?
Bruce's group,
Yeah, that's what I'm saying.
okay. My group, no humidifiers. But with Bruce's group, he might use humidifier because that's what you're gonna see. So.
That adds like an extra couple tests.
Why is it rented one?
Setting out would be the biggest issue. Because that's what we did. Is we lived more.
But I'd be willing to bet they didn't pay full price.
Yeah, they said we're getting a new one or something.
The
A
other
new,
part that sometimes happens.
Oh,
Yeah,
so
new
it's
bag.
Prices knocked down.
Connect if applicable, right? But it says when done, press accept to exit, touch exit, so just press accept.
Some hospitals were purchasing a bunch of.
Don't exit the SST.
You know, like there were about 5 weapons, they were getting a discount price,
Sweet.
25.
So always make sure you make progress. Right?
So if they were like, they
Watch the
wanted
flag.
4 of them, but they
Down
got
nice and
rates
slow.
on 5,
Excellent.
then they would work out a deal with Central Community College that they would donate one to us if we paid them.
and it'll be mean if you put a hole in the tubing, right?
So it's not really donating, but
What do you mean hole in the tubing?
So sometimes when you're SSTing, you have a whole tubing.
Because I have
So-
the outside union, that's how I know.
So they come in a box. We open it with what?
Knife or
A
whatever.
knife or a razor. Sometimes you cut so far that you might have a little splice in the tubing, and next thing you know, it's like, why does this thing keep going? So just, you've done everything. You make sure all the ports are closed. Okay, everything filters nice and tight, and then next thing you know, you still have a leak. So change the whole circuit sometimes. That's the last resort you have to end up with.
yeah, where's the patient port? It's actually, this is where I got.
You guys know what that is? This is?
Yes.
Do we need this for the exam? When you're doing an SST? So why do you think we keep adding this?
Because that's what we use.
To throw you off, right? Because what were you doing earlier?
Jerk move.
That's what I've heard.
It's not. It's a perfect filter.
Disconnected from patient.
Because the ones at union, they look like this. They look like a big one of
A
those.
small. Yeah, we have the same one.
Oh, okay.
It's the same thing. You won't see this. You'll see two filters, one's an HME and one's an
But you would do the HME then the Y. where-
HME is just, you don't need this for SST.
Alright.
You need this when you put the patient on, right? So, but we'll put this on just
You wouldn't like,
Ah.
And how often do you change the expiratory filter?
when you change the. Unless
Oh,
it's,
so-
unless it's, as needed, if it's dirty and stuff.
Yeah.
Because this will collect water.
Will it tell you it needs to be changed? No, you just.
Well, circuits should be changed, all depends on your, hospital policy, ICU policy. Maybe 7 days, you change it. Like I said, once again, the rehab, these things constantly get nasty and dirty, so.
Oh yeah.
All right, so pass.
So pass, what else do we do? Once you're done,
or a cap.
Just take it.
Ideally, we should have a cap.
Oh man.
When you get these
Good job.
now it's ready to go. Okay, so I want this patient on 75 kilograms ideal body weight. So let's say, are we putting a new patient? So
75.
75.
Okay.
Okay, what else do you need?
I mean, like.
Okay, it's gonna be intubated, right, because we're intubated?
Yep.
Okay, and then we'll go about modes later.
Okay.
Okay, so right now we're in assist control, volume control, okay? Assist control can be pressure control, volume control, or VC plus, okay? And we'll go through that as we start going through the sheets and so. So go ahead and press continue,
Just keep that.
continue. Okay, I want this patient on respiratory at 20. Tidal volume of 300.
I know one too. He was the head of the department. He cried.
Flow of 65 is fine. Sensitivity of 2. Okay, FI of 2, 21%. PEEP of 8. Okay.
It's not like that. Al was the.
So now it's just waiting for a patient to connect.
Yep.
And all you do is just connect that to the patient, these stuff.